Puerto Rico Medical Board Style Clinical Vignette. Topic: Potter Sequence. Clinical Vignette. A 24-year-old woman presents to the obstetrics clinic for her 20-week prenatal ultrasound. The ultrasound findings reveal bilateral renal agenesis. The amniotic fluid is noted to be severely decreased, and the fetus shows severe limb deformities, including club feet and pulmonary hypoplasia. The fetus also has a flattened face and low-set ears. The mother denies any family history of renal or genetic disorders. What is the most likely diagnosis for the fetus, and what is the underlying pathophysiology? A. Renal agenesis. B. Potter sequence. C. Prune-Belly syndrome. D. Meckel-Gruber syndrome. Cotter B. Pot explanation. Potter sequence is a condition characterized by a combination of physical deformities that result from oligohydramnios, low amniotic fluid, which itself is caused by renal agenesis, or severe renal dysfunction during fetal development. The key findings include bilateral renal agenesis, absence of kidneys, oligohydramnios, low amniotic fluid, which leads to fetal compression, pulmonary hypoplasia, underdeveloped lungs due to limited space to grow, club feet, flattened face, and low-set ears as a result of fetal compression in the uterus. Pathophysiology. Renal agenesis leads to the lack of urine production, which is the primary source of amniotic fluid. The absence of amniotic fluid results in the classic features of Potter sequence due to mechanical compression of the fetus during development. Incorrect options. A. Renal agenesis. Renal agenesis is the cause of Potter sequence, but alone, it does not explain the full clinical picture with facial deformities and pulmonary hypoplasia. C. Prune-Belly syndrome, a condition primarily affecting males with abdominal muscle hypoplasia, bladder dysfunction, and renal abnormalities, but it does not typically present with bilateral renal agenesis or severe limb deformities. D. Meckel-Gruber syndrome, a genetic disorder that can cause renal cysts, encephalocele, and polydactyly, but it does not typically result in the classical Potter sequence features, e.g. pulmonary hypoplasia and limb deformities. Key takeaways. Potter sequence is a result of oligohydramnios caused by renal agenesis and is associated with pulmonary hypoplasia and skeletal deformities. Diagnosis is made clinically and through imaging, e.g. prenatal ultrasound revealing renal agenesis and oligohydramnios. Prognosis is generally poor due to the associated pulmonary hypoplasia and other complications. Let me know